This is an elderly patient with history of myocardial infarction, following which he developed complications including left ventricular failure with reduced ejection fraction. He also has moderate mitral regurgitation with bilateral pleural effusion. A subcostal view was followed with an apical 4-chamber view. The ejection fraction of 32% suggests reduced systolic function, indicating that the heart is pumping out less blood with each contraction than it should. In addition, there are left ventricular wall motion anomalies. The involvement of the left anterior descending artery in the wall motion anomalies indicates regional anomalies in the contraction of the left ventricle. This suggests ischemia or damage to the myocardium in the territory supplied by the LAD. In addition, there is also evidence of mitral regurgitation. This is seen on color Doppler view. These findings collectively paint a picture of significant cardiac dysfunction. These include reduced pumping ability, valvular regurgitation, and localized wall motion anomalies. These together contribute to the patient's clinical presentation. It must be noted that these findings are indicative of a complex cardiac condition requiring careful management and follow-up to address the underlying issues. The short axis view further confirms the wall motion anomalies. Color Doppler study of the mitral valve follows next. On color Doppler, the presence of moderate MR implies that there is a backflow of blood from the left ventricle to the left atrium during the cardiac cycle. This can lead to decreased forward blood flow and contribute to the overall cardiac compromise. The mitral regurgitation flow is seen in blue color as a backflow from the left ventricle into the left atrium. In addition, there is also bilateral pleural effusion. The prognosis in this case depends on various factors, including the patient's overall health and the response to treatment. The combination of reduced ejection fraction, moderate mitral regurgitation, and left ventricular wall motion anomalies suggest significant cardiac impairment. Now we can see a moderate right pleural effusion. A moderate left pleural effusion is also present. Management of this patient must address all these issues.